Hey everyone, welcome back. I'm Frank Schaller. Today we're covering high-yield NCLEX topics. So we're talking about things like chronic cancer care, chronic immune disorders, and chronic hematologic conditions. Let's go ahead and get started. So chronic cancer care focuses on survivorship, so life after active treatment. We're thinking about things like long-term symptoms, safety teaching, and of course, follow-up care. So when thinking about breast cancer survivors specifically, we're going to want to watch for lymphedema. No blood pressures on that arm. No blood draws on that arm either. The medication tamoxifen increases the overall clot risk. And then neuropathy, know that this may be long-term. When thinking about prostate cancer survivors, they may have chronic incontinence or perhaps erectile dysfunction. Hormone therapy weakens the bones, so you're going to want to be sure to teach bone healthy habits. Thinking about our colorectal cancer patients, they may live with a stoma, and just know that healthy stoma, the color is pink. It's also, if it's red and moist, you could consider that normal as well. However, the color's gray stoma or black stoma, this is not normal at all. Thinking about lung cancer survivors. So these folks often have chronic dyspnea or trouble breathing. So we're going to want to teach them pacing. We're going to want to teach them energy conservation. And then, of course, oxygen safety as well. Next is chronic immune disorders. So we're talking about things like HIV, rheumatoid arthritis, lupus, and then also MS as well. So for HIV, the ART adherence is everything. Gonna wanna make sure the viral load is checked every 3 to 6 months. Of course, CD4 monitoring regularly as well. We'll want to teach these patients to avoid live vaccines if they have a low CD4 count. And then remember, U equals U. For autoimmune diseases, medication teaching is essential. So thinking about methotrexate, some reminders here. Weekly dosing, not daily. You're going to want to ask them to take folic acid supplement, avoid pregnancy, monitor liver function, and then watch for infection signs and symptoms. In regards to some of those biologic medications, TB test before starting, okay? Avoid live vaccines with biologic medications, and then of course, ask your patient to report any fever or coughing that is developed. With chronic steroids, we're going to want to teach to expect some bone loss, unfortunately. We're also going to want to teach to expect blood sugar changes as well. And unfortunately, mood changes are pretty common with chronic steroids as well. And then always taper this medication slowly. Never stop chronic steroids abruptly. Now let's look at hematology. So for iron deficiency anemia, ferritin is the key lab. Take iron with vitamin C and then avoid calcium with supplements. For pernicious anemia, we're going to want to know lifelong B12 replacement. This prevents irreversible neuropathy. And then CKD anemia. So the kidneys stop making EPO. And then synthetic EPO, unfortunately, raises the blood pressure. So we're going to want to monitor and check the blood pressure here. With sickle cell disease, preventing crises is the goal. So what do we teach here? Hydrate daily, avoid cold exposure, avoid high altitudes, and then of course, stay current on vaccines. With hydroxyurea teaching, just know it increases the fetal hemoglobin. It lowers white blood cell counts. You're gonna need regular labs and it requires contraception as well. In regards to teaching with hemophilia, avoid NSAIDs, avoid high-impact sports, use ice and rest for joints. Teach to wear a medical alert ID and then know how to access factor. Some patients need long-term transfusions, so this can cause iron overload. Chelation therapy removes the iron. So some important chronic labs here, ferritin, for iron stores, MCV for anemia types, reticulocytes for bone marrow, CD4 and viral load for HIV, and then platelets for bleeding risk, and ANC for infection risk. And just remember, trends matter more than single lab values. So here are the NCLEX favorites for safety. Sun protection for survivors, sun protection for lupus, infection precautions for anyone who's immunosuppressed. Remember, taper steroids slowly, never stop them suddenly. Fall precautions for folks with anemia or neuropathy. Multimodal pain management, not opioids alone. And then monitor for long-term effects from chemo and immunotherapy. Thanks for watching. If this helped your NCLEX prep, hit that like and subscribe. Drop your next topic request in the comments below. Keep studying, lock in, you've got this.